next point is make your conclusion specific to the situation. So when you are concluding your letter, that is our discharge paragraph. So your discharge paragraph should be specific to the situation, not to include irrelevant data. Always select relevant data. That means the recipient should know some kind of data that recipient should know. That kind of data you need to select for the conclusion. Next one, use your own word as much as possible. Don't simply copy sections from the case note. We know that they will keep some kind of hint points in the case note. So don't copy directly from the case note. Always frame your own sentences. That is the strategies for the overall task fulfillment. So after writing, so how we can self-assess our letter. So after writing, you need to know that is our letter so have a required length. So that 180 to 200 words. Is your letter have 180 to 200 words? Next, has your letter responded to the task question? That means our letter is whether related to the task. Third one is, does your letter focus on the important points such as chief complaint, your main concern, important social factor, and reason for writing? Chief complaint in the sense present details, and your main concern. Main concern in the sense why we are writing the letter. That is purpose. So that is a main concern and important social factor. Some of the social factor is important to the relevant history of the patient. So that also we can write in the letter. Next one, is your language in your letter original? So always check that grammar mistake in your letter. So in that way we can do the self-assessment. So that is the first criteria, that overall task fulfillment. Coming to the next criteria, comprehension of stimulus. So in the comprehension of stimulus, first strategy is read the information carefully and plan the content of the letter before beginning to write. So we all know that they will give a 15-minute for planning, sorry, a 5-minute for reading and 40 minutes to writing the letter. Not 15 minutes, only they will give 5 minutes to read the question. In that time, you are not allowed to touch your pen, pencil, or all those equipments. Simply you can read the letter and try to plan the content of the letter before beginning to write. And 40 minutes to write your letter. That is the overall time. And next strategy. Second strategy is, don't let the main issue become hidden by including too much supporting details. Always, I already told you that always give priority to the presenting complaints and presenting issues and the social factor, the past history that is relating to the relevant to the presenting history, that or supporting to the presenting history only we can select. All those details you can include. Don't include irrelevant details. And how to select the relevant data and how to eliminate the irrelevant data we can see in the further classes. And the third strategy is, base your letter from today's perspective. That means include all relevant history, but in summary form. Eliminate less important details and focus your attention on the current situation. Base your letter from today's perspective in the sense, in some case note or maybe some case note like visit details. That means a patient visit in a GP clinic for 3 days. So you will get a 3-day history of patient, day 1, day 2, day 3. So day 3 is the today's date. So always give priority to the today's perspective, today's clinical data or today's symptoms. And you can write all previous date history has a past history. That is, base your letter from the today's perspective. Last strategy is show clearly the connection between information in the case note if these are made. However, do not add information that is not given in the case note. So, some of the information in the case note we can connect each other. So, you can select those information and make as a one sentence with a good connectors or signal good connectors. So how to connect all these things we can going to see in the next class. So how we can do the self-assessment. Have the key points been mentioned and grouped appropriately? So you need to check that have you select the key point or have you mentioned or have you connected all these points appropriately. Next, have you identified and emphasized the reason for writing the letter? Next one, have you selected relevant information and omitted no relevant information? So you need to check that is your points are relevant to the recipient. Have I selected any kind of irrelevant information or non-relevant information? Am I written in a short way or concise way? You need to do a self-assessment before submitting your answer letter. Clear? Hello? Alvin, clear? Do you have any doubt? Okay, fine. Thank you. So the next one is appropriateness of language. So language in the sense we are doing an we are writing in a relevant information in a correct language or correct grammar. So we are doing like organize the information clearly into paragraph. So the sequence of the information in the case note may not be most appropriate sequence of information of for your letter. So in the case note, the information is not in a or not in a order. So you need to read the case note and make plan good structure or make an order of the letter, order of the point. Then you can write in a then you can frame a good sentence for your letter. That is appropriateness of language. And always keep in mind the reason for writing. Don't just add information randomly. So always before writing, always check that these information are connected. Some of the information we can connect each other. So please make sure before writing that these information can be connected each other or not. Third one is avoid informal and casual expression and maintain a formal tone. So we can't include any kind of formal word or casual word. Always write in a avoid informal word. Always write in a formal tone. Formal tone in the sense you cannot use so some all those words you cannot use in the OET letter. These are the, if you know that these are the casual words, so always maintain in a formal tone. So last one is do not overuse medical terminology, including abbreviations and acronyms. So we know that some of the short forms will be there in our case note, like HTN, DM, and AI, RT, RTI, then MI, BMI. These are some of the abbreviations. So don't overuse this kind of medical terminology. If you need it, you can write in a full form. Okay, that is the appropriateness of language. We need to know that if the recipient is already a medical person, then we can write in the short form. If the recipient is not a medical person, you need to avoid this kind of medical terminology maximum, or you can write in a full form way. Next one is control of linguistic features. Control of linguistic features. First one, show that you can use language accurately and flexibly in your writing. So when you are writing, you can show that you are using a appropriate language and you are using in an accurate way. Second one, ensure you use correct verb, tense and form as this is an essential requirement. Third one, make sure you demonstrate a range of language structures, use compound and complex sentence as well as simple sentence. So either you can use a compound or complex or together also you can write. Or simply you can write in a simple sentence also. So maximum you can include 5 to 7 error in the letter. So reduce your chance of getting B grade or higher. So if like more than 7 error in the sense your B grade will be reduced to C+. So always try to use connecting words and phrases to link idea together clearly. Example, connected words, example, however, therefore, at that time, as a result of, then, despite of. These are the connecting words. So try to use for the to make a compound sentence or complex sentence. Last criteria is control of presentation features. Control of presentation features include follow standard letter format for referral letter. So we have a format like first we need to address or date. Second, you can write either address or date. Third one, after that, salutation like a dear Dr. X or dear sir or madam. Followed by that, you can write referral. That is RE. Name of the patient or and age or date of birth. After that, the content. That is our format of the letter. So strictly try to follow the format and use correct punctuations including comma, capital letter appropriately. So always before submitting your letter, check the punctuation like full stop, comma and semicolons, etc. And check for spelling also. So spelling mistakes and poor spelling consistency through your letter, like misspelling the patient's name is not good. Exactly. So always try to check the spelling of the word. Organize the letter into clear paragraph and leave a blank line between the paragraph to show the overall structure of the letter. So when you're writing the letter, after writing the date, leave a line. Then you can write the address. Again, you can leave a line. Followed by that salutation and referral. Again, leave a line. Then you can write the introduction paragraph and content paragraph and the discharge paragraph. So in between that, always you need to leave a blank line to show the overall structure of the line. So these are the criteria you need to follow while you are writing the case note or letter. Now we can see a sample letter. I'll show you a sample case note and the answer of the letter. So this is how your OET letter case note, writing task and your subtest for nursing. Then time allowed, reading time 5 minutes, writing time 40 minutes. And read the case note and complete the writing task which follows. So case note under case note, patient details will be there. That is patient name, discharge date, age, diagnosis, whether divorced or not, married or not, single or not, all those details. That is family, social history, address, phone number, and the admission date when the patient is admitted to our hospital. And the past medical history is the patient have any kind of past medical history like diabetes, dementia, hypertension, all those things. And the present history, for what purpose the patient is admitted to our facility or admitted to some other facility. Like here you can see that the fracture is suspected to be resultant of recent fall. Patient is currently receiving continued care from aged care agency. So after that, assessment will be there. That is during the admission or during our consultation, maybe the doctor or you have done kind of assessment. So the result of the assessment finding. So significant discomfort in his left thigh region. X-ray has done which confirm a fracture in his left femur. Due to his medical history, it is important to manage a fracture with careful consideration of his existing condition. So the treatment also there. What kind of treatment we have done during the hospitalization? So first point is initiated pain relief measurement to elevate Mr. Peter's discomfort, administered ibuprofen pain, medication as per physician recommendation. So ibuprofen has administered and orthopedic specialist through evaluation of fracture. So consultation with the orthopedic specialist he had done. Then patient has dementia, so require assistance in movement to prevent further injury. So they have requesting for assistance. So these are the treatment history and a follow-up visit also they have scheduled. So these are the patient case note, and our task is write a transfer letter. So from our facility to the aged care, some other facility we are transferring the patient. So that's why write a transfer letter to the aged care manager, aged care agency, NSW Australia to request further care. So need to do a further care or continued care will be done. That is the writing task. And how we can select the relevant or irrelevant data. So patient name is relevant, patient discharge date is relevant, age and diagnosis. But see, you can see that the patient is currently receiving in the present history. You can see patient is currently receiving continued care from aged care agency. So it is a known case. Already patient have under the care of aged care agency. So already known case. So we don't want to write whether divorced, address details and phone number, all those things, and past medical history also we can avoid because it is a known case. Only we can write present history and assessment treatment. After admission, what are the procedure and what kind of treatment we have done. All those details we can do. All those details we can include in our letter. Okay. So, and treatment history, you can see treatment details as given, like ibuprofen has initiated, that we need to write, and orthopedic specialist consultation has done, that also we need to include, and patient has fracture dementia, request assistance, that we need to request to the recipient. Then we have provided him with a wheelchair and recommended gentle range of motion exercise, that we need to include in the discharge paragraph. Then monitoring of Mr. Peter's blood glucose level to ensure diabetes management is not compromised during healing process. So patient has a history of diabetes, so we need to monitor the blood glucose level. That also we need to mention to the letter. And then patient is taking hypertension medication, that also we need to include. Implemented strategy to manage Peter's dementia during recovery. So communication they have done, like education they have done. So a follow-up appointment with the orthopedic specialist they have scheduled. These are the things we need to include in the discharge paragraph. So these are the relevant data. In this letter, the social data and the past history, these are the irrelevant details because patient is already known to the aged care manager, because patient is already under the care of aged care agency. So we don't want to include again the social history and the past medical history. Now we can see a sample letter of, like the answer letter of this one. so that you will get a clear information. So this is the structure, this is the format of the letter. Either you can write address first or date first. If you are writing the date first, after that you can write the address of the recipient, followed by that the salutation, dear sir, and comma. If you are putting the comma there, then you need to put the comma after yours sincerely in the last conclusion portion. So here, dear sir, referral Mr. John Peter. Mr. John Peter, aged 76. Age you can mention in the referral. So I am writing on behalf of Mr. John Peter, who is currently under the care for the fracture of his left femur. He requires extended care and support. So we are writing behalf of John Peter. In that way you can write, or you can write, I am writing to refer Mr. John Peter, who is currently under the care for a fracture of his left femur. Already patient has dementia, but our priority is fracture because patient has admitted patient has admission for the treatment of fracture. And on 10/5/2022, that is admission date, on 10/5/2022, Mr. Peter. In the introduction paragraph, we can write the full name of the patient, and after, followed by the introduction, in the content paragraph, you need to write only the surname of the patient or the adjective, and pronoun, like he, she, him, her, like that. So Mr. Peter was admitted following a fall. An X-ray was done for him, which confirmed the diagnosis. He was initiated with the pain relief measures, administering ibuprofen as recommended by his physician, while taking into consideration his existing conditions and medication. So, patient has admitted following a fall. So, some kind of symptom has there, but we done the X-ray for him, and X-ray has confirmed the fracture of the left femur. So that's why we have done wrote here. So we don't want to mention the diagnosis again. Already we have mentioned the diagnosis in the introduction. Next one, he was initiated with a pain relief measurement. In the treatment, we have already saw that ibuprofen has administered recommended by the physician. That we can write. So first we need to write why the patient is admitted, then followed by that any assessment if you have done that you can write. After that, what is the treatment we have done, that you can write. After treatment, is there any progress patient has shown, that also we can write. That is of the content paragraph. So yeah, so while taking the consideration of his existing condition and medication, furthermore, an appointment has been scheduled with an orthopedic specialist to evaluate the severity of the fracture and guide future treatment options. So that we have done in the treatment, so that's why we have included in the paragraph. Then, in the past medical history, Mr. Peter has had diabetic mellitus. You can start with, as you know, Mr. Peter has had diabetes mellitus and hypertension, because in this letter we didn't correct the letter. So you need to start the paragraph with as you know, because it is a known case. Patient, the recipient already known that patient has hypertension and the diabetes. So that's why we need to start this paragraph by as you know. As you know, Mr. Peter has had diabetes mellitus and hypertension. Due to the fracture and his dementia, he required assistance with the movement to prevent further harm. He has been provided with a wheelchair and advised on gentle range of motion exercise. That is the so that is a part of the treatment. Continuous monitoring of his blood sugar, blood glucose level, and consistent administration of his hypertension medication are also being upheld. So need to monitor the hypertension and diabetes. That is why we have included the history of diabetes and hypertension. So we can conclude the paragraph by, it would be greatly appreciated if you could monitor the medication. In addition, a follow-up appointment. So patient has a follow-up appointment, that also you can include it in the letter. So when you are concluding the letter, always you need to write, do not hesitate to contact me for further queries. You are sincerely, Charles. This is how you need to write your letter.